Hi there, my name is Kirsten Thornhill, and today's presentation will be on the implementation of exercise in patients with cardiovascular disease. This presentation is for HS 740, Teaching and Learning Theory. Our lesson objectives today, students will be able to role-play a clinical case scenario exercise prescription assessment for a patient with cardiovascular disease, also known as CVD, as well as being able to create and plan an exercise prescription chart for a clinical patient with CVD utilizing the FIT principle table. So to kind of get things started, we're going to look at the foundations of exercise prescription and what we think of when we hear the word prescription. Most of us, as I can assume, when we think of prescription, we think of a physician writing down some type of pharmacological pill type of prescription. Nonetheless, exercise can also be prescribed in this manner. So what is it? By definition, exercise prescription is the type, intensity, duration, frequency, and progression of physical activity. These 5 elements are applicable to the development of exercise programs for individuals regardless of functional capacity, age, and the presence or absence of cardiovascular disease risk factors or cardiovascular disease itself. So what are the recommendations for patients with cardiovascular disease for exercise? The American College of Sports Medicine is well known throughout the health and wellness industry as the quote-unquote gold standard when it comes to exercise recommendations. As of 2017, ACSM has recommended 90 to 150 minutes per week of moderate to vigorous intensity aerobic and resistance exercise training for chronic disease populations. This includes cardiovascular disease patients. To make this directly applicable to our target population of this lecture, patients with CVD having a systolic blood pressure greater than 140 millimeters of mercury or diastolic blood pressure greater than 90 millimeters of mercury. Lifestyle and pharmaceutical treatments are recommended in addition to physical activity. So, exercise programming 101. Even though it may be a little funny that I chose cookies, given that we're talking about patients with CVD, potential hypertension, diabetes, we're going to be using the FIT principle, which stands for frequency, intensity, time, and type. And I'm going to relate this to the analogy of baking cookies. So to start off, we have our F for frequency. So this part of the exercise program is telling the patient how often. So how often are we going to have them participate in physical activity? Are we quantifying that by days per week? Are we quantifying that monthly, yearly? What does that look like? So for this aspect of our cookie dough recipe, this will be our chocolate chips. So how often are we putting chocolate chips in our dough? I for intensity. So this is communicating to the patient how intense of the exercise are they going to be completing. Is that based on heart rate percentages? Is that based on their own rating of perceived exertion? How are we quantifying that to them? For example, are we writing, okay, I want you to exercise at 75% of your heart rate max. This is a numerical number that we can provide to patients so they know how hard to exercise. For our cookie dough recipe, this is our flour. Flour is often difficult when you're trying to use the measuring cup to measure the perfect amount. We can relate this to intensity. We may prescribe a certain intensity, but over time and while we're working with the patient, we may need to alter that. So that's our flour. Our first T, type. So what modality or type of exercise are we going to be prescribing for our patient? Do they like to walk outside at their local park? Do they like to go cycle or use the pool at the gym? We're wanting to select this type of exercise that is personalized for our patient that will increase their opportunities of adherence. So we're wanting to select things that the patient maybe shares with us that they're interested in or that they enjoy doing. This is our eggs for our cookie recipe. There are tons of different types of eggs we could be using: farm fresh, grade A, large eggs, small eggs, brown eggs. So the type that we select here for our recipe is heavily based on our preference. Our final T is time. So how long are our patients going to be performing this exercise? We also want to numerically quantify this. So what duration? Okay, I want Sally to exercise for 30 minutes a day, this amount of weeks. So what is a specific time? I want you to do this for 10 minutes. So we've got our cookies, we've got our dough, we've got our flour, chocolate chips, eggs. We've mixed it all together and created this FIT principle cookie. So now we're ready to put it in the oven and see what our final product will be. Thus, we arrive at our FIT principle table template. So we've created this. Is there a perfect recipe? Is there a one-size-fits-all, quote unquote cookie cutter approach? As I'm sure you can assume, no, there's not. Again, the word personalized for our patient is key here. So if we look at the FIT table on the left, we have our FITT in our first column, and across the top we have aerobic, flexibility, endurance, strength, and body composition. These are some of the important components that are coming into play when we're creating this FIT principle. So aerobic training, what does this look like in this column? Flexibility, endurance, strength, and body composition is on here primarily because patients with cardiovascular disease, as we know, typically have hypertension. So body fat and body fat percentage may be a component in their FIT principle goals. Here's our FIT principle application. So I've also included the FIT table again here, but with hypothetical numerical data to give you guys a better insight on what this is going to look like when you're going to be starting to work through creating these FIT principles for your exercise program. So for example, we have aerobic. I want Sally to exercise 3 to 4 times a week at 60 to 75% of her heart rate max, and she's going to be brisk walking for 20 to 30 minutes. These are very quantifiable and direct things that we can share with Sally, and we can also do progressions and regressions based on her rating of perceived exertion, and then also her psychological perception of how the exercise makes her feel. And if we follow suit to the left or continue to the right, we'll see flexibility, endurance, strength, body composition. Body composition isn't necessarily quantified numbers. That may be more qualitative in the aspect of how we write this out. So even though we want Sally to, use the scale to weigh herself, she can write down that specific number. But creating the habit within the FIT principle may be a verbal or wordy description here. Just like, doing a daily food log, having a light to moderate influence in monitoring your body composition, and she may also, use a food app to track her intake. And this could take anywhere from 5 to 10 to 15 minutes, depending on the patient's personalization with how much they want to focus on that aspect. Here are our references that I utilized for this lecture, 2 of them being our current textbook, as well as the assigned readings for this unit. So let's go ahead and get into our clinical case scenarios. So in front of you, there should be an index card. You will be working through this clinical case scenario with your classmate on your left. What this is going to look like is it's going to have the patient's symptoms, a little bit of their health history on here, and you're going to collaborate with your partner, and you're going to start to come up with filling out the FIT principle table template based on the information I provide for you. I'd like you guys to work together for about 5 to 10 minutes, working through these, one of you taking the role as the clinician and one of you being the sample patient. So first, we have Sam. He's 55 years old. He has a family history of coronary artery disease. He is considered overweight according to his BMI. He is a little hypertensive. He has a high resting heart rate. His electrocardiogram has ST segment abnormalities. He is on medication for his hypertension, and he does have approval for exercise. So this is sample case 1. Case scenario 2, we have Nora. She is 65 years old, no family history of cardiovascular disease. She is obese. She has a blood pressure of 152/99. Her resting heart rate is also high, and her electrocardiogram is normal. She does take medication for her type 2 diabetes and hypertension, and she also has physician approval for exercise. So again, I'd like for you guys to work in partners, and we'll come back together in about 5 to 8 minutes and start to go through the aspects of your FIT principle template. Thank you.